We're going to explain perimenopause in 90 seconds or less. It's so important that everyone understands this because 100% of us will go through it if we live long enough. Females are born with all of their egg supply. At birth, we have 1 to 2 million eggs. By the time we're 30, we're down to about 10% of that egg supply. And by the time we're 40, we're down to about 3% of the original egg supply. We lose those eggs through the process of ovulation. About 10,000 eggs die to get one to ovulate each month, and from the aging process as well. In a healthy woman, before menopause, this is what the monthly menstrual cycle looks like. It's pretty predictable each month. We have a normal ebb and flow, almost EKG-like rise and fall of 4 separate hormones: estrogen, progesterone, LH, and FSH. Why does this happen? It starts in the brain. The hypothalamus in the brain constantly senses the blood for estrogen levels. And when the estrogen levels decline in a normal ovulatory cycle, it sends out a stimulating hormone called GnRH to the pituitary. The pituitary then produces LH and FSH, which then go to the ovaries, bind to the cells around the eggs, and produce estrogen and then progesterone. The cycle is repeated month after month after month until we reach perimenopause. What happens in perimenopause is we reach a critical level of egg supply where the signals from the brain no longer work. There just aren't enough eggs to respond to those signals. This incredible work was done in 1996, tracking a woman's estrogen and progesterone levels through perimenopause over 6 months. What used to look like this every month for 6 months now looks kind of crazy. Because the ovaries can't respond, the brain keeps sending more and higher signals to the ovaries to force the ovulation. Ovulations are delayed, the progesterone levels never quite reach where they used to, and the estrogen levels fluctuate wildly. Now this is comparing 6 months of hormone levels from a premenopausal, perimenopausal, and postmenopausal woman. 6 months of normal ovulatory cycles, 6 months of chaos, and 6 months of flatlining. That's why we call perimenopause the zone of chaos. Postmenopause represents when we just run out of eggs. Perimenopause, the zone of something's not right, I can't put my finger on it, wild fluctuating periods, and lots of cognitive and mental health changes. This chaotic zone is also why we don't have great blood, urine, or saliva tests to make the diagnosis. We listen to patients, we believe her, we may rule out overlapping conditions, and then we let her know she's in perimenopause and begin treatment.